Dear doctors, hello and welcome. This is Deepak Mishra once again, and I welcome you all to section 2 of this roadmap towards medical PG in Germany. In this section 2, we are going to learn about the various requirements, the documentation process that you need to do. Plus, we are also going to learn about the examinations and their preparation strategies and other required material that you need to have to study or prepare for Fachsprachprüfung and Kenntnisprüfung. Alright, so in this video, going to the presentation, we see that the requirements to apply for medical license in Germany. First is the eligibility criteria. Eligibility criteria is not very special. It's just that you have to be a doctor. That means you must have passed a medical curriculum in a recognized medical school. You must have a registration, a medical registration, a license to practice medicine in your own country, and you must have done 12 months of compulsory rotation, that is the internship in different departments. That is compulsory. If you have these, then there are many queries about what if I have a supplementary, if I have failed 1 year, if I have a gap. Those things don't matter as much as far as documentation process is concerned. For documentation process, you need to be a doctor. Are you a doctor in your own country? Can you practice medicine? Can you prescribe medicines in your own country? Can you operate? Do you have a license? That is what counts as eligibility criteria. So you had less marks, more marks, does not matter. Instead of 6 years, you took 8 years to complete this course. That does not matter at all. That is the eligibility criteria. Also, age does not matter. Many people say that, okay, now I'm 35 years old. Can I still pursue post-graduation in Germany? I would say, why not? Obviously, with age, the inclination, the willingness to learn a new language, to modify to a new surrounding, modify to a new system, that decreases. The willingness decreases. You will very easily get frustrated. You will very easily get fatigued. Those things are there. But then if you're determined, then why not? 35, I said, 35 is not a bad age. That is more of like 45 years. Somebody is like in 45 years old and then plans, then theoretically it is possible. People have also done that. People from Arabic countries have done that. But is it easy? No, it's not easy. Your learning the language will be difficult. Your pronunciations will be difficult. You will have difficulty in adjusting and coping up with the totally new system when you are already experienced in your own country, in your own system. But then theoretically, can a 45-year-old or a 50-year-old for that matter take up medicine in Germany? Theoretically, yes. Age is not the criteria. Some hospitals prefer experienced doctors. Some prefer freshers whom they can teach. Okay. Going to the second point is the personal and academic documentation and the documents that you require from Germany. About this, we'll go in further slides, we'll see in more detail. I will cover the third point first here, that the German language requirements. I have mentioned many times over my YouTube channel as well that you need a B2 level of General Deutsch, Allgemein Deutsch, Allgemein German, from an institute which is certified with CEFR, that is Common European Framework of Reference. Okay, which institute are those? There are many you can find on the internet, but most famous and the most standard is the Goethe Institute. Goethe Institute is in many countries around the world, and if you study from Goethe Institute, it is considered as the best. However, Goethe Institute is not the only institute which is good, because and it's not the only option for you, because Goethe Institute for people who do not live in the cities where Goethe Institute is located, or people who are working professionals and do not have time to visit an institute, for them it is not end of the road. There are many other institutes which are also good enough and where you can also learn good German. About this, good institutes, how you should find out is that obviously talk to the previous students. See if there are good enough doctors learning over there. Check out the forums, the Facebook groups. We, Dominance International, also have a language academy. We have online, we teach online. It's basically cut out for working professionals who do not have much time and have a very busy schedule. For them, we have started this online course. You can check out about that also on our website. But it is irrelevant which language school you study. At the end, you have to take a standardized exam, that is a Goethe exam. You can appear as a Goethe exam as an external candidate, and you can, once you pass that exam, that certificate is recognized by all states in Germany. Alright, so moving ahead to the fourth point is exams to be passed, that is about the Fachsprachprüfung and the Kenntnisprüfung. For that, there is a totally separate video where I have talked about the qualifying exams, and the study material are also posted on that section. Alright, then here in this video, we continue further with point number 2. That is the documentation required from your side and the documentation that you have to arrange from Germany. Moving ahead, here we see what documents are required. Personal and academic, birth certificate, change of name certificate. That is in case of marriage. If the name changes, then you will need a proof of that. Your passport will be your identity proof. Your for candidates who are applying from outside Germany, they will need a police clearance certificate. For this police clearance certificate, you do not have to worry that okay, it will get old or it will be not recognized or anything like that. You can get your police clearance certificate from passport office. In India, I know about passport office. Other countries, I'm not sure where do you get police clearance certificate. Maybe from the police or maybe from some administrative office or the court maybe. But here this is not a major concern, because once your documentation is finished, once your Fachsprach exam is done, before you get your temporary license, your Berufserlaubnis, you will be asked again to submit a fresh police clearance certificate. Because by the time you complete everything, there will be around almost 8 to 10 months or maybe 1 year. So in that case, you will be again asked to submit your police clearance certificate. And if you have lived in Germany during that time, then you can get it from Germany as well, from the Ausländerbehörde or the Rathaus. That is the authority for foreign citizens in Germany. Every city has a Ausländerbehörde or a Rathaus. Good. Then moving to point 4. Good standing certificate from Medical Council of India. Here I have talked about India. That basically what I mean is a central medical authority of your country. Further, moving ahead, what you need is your MBBS qualification. That is your medical graduation. If you are already a postgraduate, then obviously you can also apply with your postgraduate qualification. MBBS exam, passing certificate, if available. That means here during your MBBS curriculum, your transcript, your mark sheet, your internship completion certificate that is going to come ahead, your passing certificate of different exams, everything is important. You have to attach all of these. Then registration with the medical council or your state medical councils. Here I have talked about India, but here it means that your license to practice medicine, that has to be attached. Your experience certificate will also play a role. If you have them, then you attach them. The important thing that one has to notice is all these documents have to be translated. The passport need not be translated, but other documents that I have mentioned needs to be translated from a sworn translator in Germany. That means the companies that offer a translation, those private companies, those translations will not be recognized by the government body in Germany. These translation costs you around 30 to 45 euro per page. That is why one has to be very careful which documents do you get translated? Because translation you can get anytime, but unnecessary documents you should avoid because it is relatively expensive getting the documents translated. While sending your documents, what do you send? You send the attested copies. You make copies of your original documents, plus you make copies of the translation. You make bundles of those, then you get that attested from the embassy, from the German embassy near you. You never send original documents to Germany, because the safety of those documents is not guaranteed. The documents can get lost, can get damaged, and you cannot hold anybody responsible, because they have also very categorically mentioned on their websites that please do not send us original documents. Alright, so moving further, we will see what documents are required from Germany. When you apply for your visa, you will need a hospitations contract. It is not necessary, not just for visa. I've skipped one step. When you apply with those documents that I mentioned to the medical council for your medical license, that time you will need reason why you are applying to one particular state. And the reason why comes here. The answer is you have either a hospitation invitation from one of the states, that is why you are applying there, or you have applied to multiple hospitals over there and looking for a job, and you have been at least invited for interviews, or you have email communication with those hospitals. So these are the important reasons which show your intention that, okay, why this particular state. Most important, for which many states now are very adamant, is the Einstellungszusage. Einstellungszusage is a job appointment letter. That means the one hospital should be ready to write and sign that we are going to, or we are willing to employ this doctor provided he or she clears his licensing exams. Now getting this letter without having stepped foot in Germany is very difficult. That is why you should assume that this you will not have, this Einstellungszusage, while you are in your home country. This you will only have once you come here. So, but what you can do is, you can get hospitation contract. You can get emails, replies, asking you for interviews. You can do Skype interviews for that matter. And with these things, which shows intent, you can apply to the medical council. If the medical council very categorically tells you that no, we will not accept your application under these circumstances, then fine, then you'll have to look to another state. For example, the state of Niedersachsen very clearly mentions that no, they are not going to take application from people who just have hospitation or just have interviews. They want a concrete job appointment letter from one of the hospitals. Only then they are going to accept your application. So in that case, that option is out of question. Where is this option viable? Option is viable in Northern Westfalen, or was viable a couple of months back in Northern Westfalen. We are going to see in a separate video the forms of these 3-4 states and what they have actually mentioned in those forms. And there you will see which state says what. I have not made forms of all 16 states, but 3 states is good enough to understand what we mean. Okay, so moving ahead, what else do we need? Führungszeugnis. Now, what is a Führungszeugnis? Führungszeugnis is similar to the police clearance certificate. This you get from the German authorities, that is the Ausländerbehörde or the Rathaus. Ärztliches Attest, that is the medical fitness certificate. That also you will get from a German doctor in Germany. The fitness certificate that you get from local GP in India or in your home country is not valid here. You can very well do that, send it, but then they are going to ask you again for that. Or rather, you can say in your application form that, okay, I will send it later on once I reach Germany. Sixth document is the Eingangsbestätigung. This Eingangsbestätigung, you do not have to send to medical council. This is what you will get once you have sent your entire package to the medical council for licensing exam. You will immediately, or not immediately, within a couple of months get Eingangsbestätigung. Now, Eingangsbestätigung is a receipt of application. That is, we have received your papers. That is nothing more than that. And that receipt, that Eingangsbestätigung, can turn out very significant when you apply for your visa. Because then the visa officer knows that, okay, his documents are already there, he's in the process, he knows the system. Then I'm talking about 17A visa here. So that can work out positively. Even better is a deficit Bescheid. Now, deficit Bescheid means that your documents are not only seen or not only reached, they're also processed. That means an officer in a medical council in Germany or Approbationsbehörde or wherever the location is, because different states have different locations, wherever you have sent your documents, an officer over there has gone through your papers and have diagnosed or has decided that, okay, these are the deficits, these needs to be done, rest is okay. If you have that deficit Bescheid, then that is even more better for your visa. Your visa becomes almost certain if you have deficit Bescheid. But these two I have mentioned as the documents for from Germany, but this is not before application. You will get this after application. This is for visa, very important. This does not mean that without this you cannot get visa. But then the type of visa, your instead of 17A visa, you will have to apply for 16B visa. About visa, we are going to talk in a separate lecture, but for now, you have to understand that deficit Bescheid is important. Alright, with this, I conclude this lecture. I hope it was useful to you. Please write comments in the comment section so that I will get some feedback that what are you liking, what you're not liking, how I could improve this course. So it would be very nice if you guys could respond and write